term Leishmaniasis encompasses multiple clinical syndromes, several of which will be described in this video. The cutaneous, mucosal or subcutaneous, and visceral forms, which result from infection of macrophages in the dermis, in the naso-oropharyngeal mucosa, and throughout the reticuloendothelial system, respectively. For all three forms, the infection can range from asymptomatic to severe. Cutaneous and mucosal leishmaniasis can cause substantial morbidity, whereas visceral leishmaniasis can be life-threatening. Cutaneous leishmaniasis. This is the most common form of leishmaniasis, both in general and in US travelers. Unless otherwise specified, cutaneous leishmaniasis refers to localized cutaneous leishmaniasis, rather than to much less common forms such as diffuse cutaneous leishmaniasis and disseminated cutaneous leishmaniasis. Different Leishmania species cause Old World versus New World cutaneous leishmaniasis. In the Old World or Eastern Hemisphere, the etiologic agents include Leishmania tropica, L. major, L. infantum, and L. donovi. The main species in the New World, or the Western Hemisphere, are either L. mexicana species, L. amazonis, and L. venezuelensis, or the subgenus Viana, L. brasiliensis, L. panamaiasis. L. infantum and L. chagasti also cause cutaneous leishmaniasis in the New World. Mucosal leishmaniasis traditionally refers to metastatic sequelae of the New World cutaneous infection, which results from dissemination of parasites from the skin to the nasal oropharyngeal mucosa. Mucosal leishmaniasis is caused by species in the Viana subgenus, typically L. v. brasiliensis, but also L. v. panamaiasis, and sometimes L. v. guianesis. It can also be caused by Leishmania amazonis, but systemic treatment of cutaneous leishmaniasis caused by these species may reduce the risk for the mucosal disease, but some risk may remain. The magnitudes and determinants, parasites and host factors, of the risk of mucosal dissemination and for mucosal disease per se are poorly understood, even for the same species. The risks appear to vary among geographic regions of the Americas. Mucosal leishmaniasis usually becomes clinically evident within several years, sometimes as long as decades, of the original cutaneous lesions, which typically were not treated at all or were treated suboptimally. However, mucosal skin lesions may be noted concomitantly, and some patients had subclinical cutaneous infection. The initial manifestations of mucosal leishmaniasis are usually persistent, unusual nasal symptoms such as stiffness or bleeding, although oral or pharyngeal symptoms are sometimes noticed first. If untreated, the disease can progress to ulcerative destruction of the nasal oropharyngeal mucosa, such as the perforation of the nasal septum. Visceral leishmaniasis. The general term visceral leishmaniasis encompasses a broad spectrum of severity and manifestations, although the incubation period generally ranges from weeks to months. Asymptomatic infection can become clinically manifest years to decades after exposure in people who become immunocompromised for other medical reasons, such as HIV or AIDS. Visceral leishmaniasis is caused by the species L. donovi and L. infantum, and affects internal organs, particularly the spleen, the liver, and bone marrow. The stereotypical manifestations of clinically manifest visceral infection include fever, weight loss, hepatosplenomegaly, pancytopenia, a high total protein level and low albumin level with hypergammaglobulinemia, Lymphadenopathy may be noticed, particularly in some geographic regions, such as Sudan and South Sudan. There are several different forms of leishmaniasis in people. Some people have a silent infection without any symptoms or signs. The most common form is cutaneous leishmaniasis, which causes skin sores. The sores typically develop within a few weeks or months of the sandfly bite. The sores can change in size and appearance over time. The sores may start out as palpules or bumps or nodules, also known as lumps, and may end up as ulcers, like a volcano with a raised edge and central crater. Skin ulcers might be covered by scab or crust. The sores are usually painless, but can be painful. Some people have swollen glands near the sores, for example under the arm, if the sores are on the arm or hand. The other main form is visceral leishmaniasis, which affects several internal organs, usually the spleen, the liver, and the bone marrow, and can be life-threatening. This illness typically develops within months, sometimes as long as years of the sandfly bite. Affected people usually have fever, weight loss, enlargement of the spleen and liver, and low blood counts, a low red blood cell count, anemia, and a low white blood cell count, leukopenia, and a low platelet count, thrombocytopenia. Mucosal leishmaniasis is an example of one of the less common forms of leishmaniasis. This form can be a sequela or a consequence of infection with some of the species that cause cutaneous leishmaniasis in parts of Latin America. Certain types of the parasite might spread from the skin and cause sores in the mucous membranes of the nose, mouth, or throat. Before considering treatment, the first step is to make sure diagnosis is correct. Treatment decisions should be individualized. Examples of factors to consider include the form of leishmaniasis, the Leishmania species that caused it, the potential severity of the case, and the patient's underlying health. The skin sores of cutaneous leishmaniasis usually heal on their own, even without treatment, but this can take months or even years, and the sores can leave ugly scars. Another potential concern applies to some, but not all, types of the parasites found in Latin America. Certain types might spread from the skin and cause sores in the mucous membranes of the nose, mouth, or throat. Mucosal leishmaniasis may not be noticed until years after the original sores have healed. Ensuring adequate treatment of the cutaneous infection may help prevent mucosal leishmaniasis. If not treated, severe cases of visceral leishmaniasis are typically fatal. Cutaneous leishmaniasis. This is the most common form of leishmaniasis, both in general and in US travelers. Unless otherwise specified, cutaneous leishmaniasis refers to localized cutaneous leishmaniasis, rather than to much less common forms such as diffuse cutaneous leishmaniasis and disseminated cutaneous leishmaniasis. Different Leishmania species cause Old World versus New World cutaneous leishmaniasis. In the Old World or Eastern Hemisphere, the etiologic agents include Leishmania tropica, L. major, L. infantum, and L. donovi. The main species in the New World, or the Western Hemisphere, are either L. mexicana species, L. amazonis, and L. venezuelensis, or the subgenus Viana, L. brasiliensis, L. panamaiasis. L. infantum and L. chagasti also cause cutaneous leishmaniasis in the New World. Treatment. The treatment approach depends in part on the host and parasite factors. Some approaches or regimes are effective only against certain Leishmania species or strains, and only in particular geographic regions. Even data from well-conducted trials are not necessarily generalizable to other settings. Of particular note, data from many clinical trials of therapy for visceral leishmaniasis in parts of India are not necessarily directly applicable to visceral leishmaniasis caused by L. donovi in other areas, to visceral leishmaniasis caused by other species, or to treatment of cutaneous and mucosal leishmaniasis. Special groups such as young children, elderly persons, pregnant or lactating women, and persons who are immunocompromised or have other comorbidities may need different medications or dosage regimes. Treatment with pentavalent antimonal compounds. The traditional mainstays for treating leishmania since the 1940s have not been approved by the Food and Drug Administration and are not commercially available in the United States. However, the SPV compound, sodium stibogluconate, also known as pentazam, is available to US licensed physicians throughout the CDC drug service. Under a new drug investigation protocol, although pentastam is not new or investigational, the IND mechanism makes it possible for the CDC to stock and provide the drug in the United States. The CDC's IND protocol covers intravenous and intramuscular administration. In the United States, the most common route for administration is IV, because the volume per dose is relatively high. One parental agent, liposomal amprofosectin B, known as ambisome, which is also administered by IV infusion, is FDA approved for treatment of visceral leishmaniasis. In 2014, the FDA approved the oral agents molitofosine for treatment of cutaneous, mucosal, and visceral leishmaniasis caused by a particular Leishmania species. In adults and adolescents of at least 12 years of age who weigh at least 30 kilograms or 66 pounds, the FDA approved treatment regime for persons of this weight. Prevention and control. No vaccines or drugs to prevent infection are available. The best way for travelers to prevent infection is to protect themselves from sandfly bites. To decrease the risk of being bitten, follow these preventative measures. Avoid outdoor activities, especially from dusk till dawn, where sandflies are generally the most active. When in outdoors or in unprotected quarters, minimize the amount of exposed skin. To the extent this is tolerable in the climate, wear long sleeve shirts, long trousers, and socks, and tuck your shirt into your trousers. Apply insect repellent to exposed skin and under the ends of sleeves and trouser legs. Follow the instructions on the label of the repellent. The most effective repellents generally are those that contain the chemical DEET. When indoors, stay in well-screened or air-conditioned areas. Keep in mind that sandflies are much smaller than mosquitoes and therefore can get through smaller holes. Spray living and sleeping areas with an insecticide to kill insects. If you are not sleeping in a well-screened or air-conditioned area, use a bed net and tuck it under your mattress if possible. Use a bed net that has been soaked or sprayed in pyrethroid-containing insecticide. The same treatment can also be applied to screens, curtains, sheets, and clothing.